Welcome to the Less Invasive Podcast, a podcast covering minimally invasive surgery and assistive technologies for the operating room and radiology environment. I'm your host, Lucien Blondel, co-founder and CTO of Quantum Surgical, a medtech startup commercializing the Ep8 robot for percutaneous tumor ablation. I bring to the table 20 years of experience in imaging and robotics for orthopedics, neurosurgery, spine surgery, interventional radiology, and interventional oncology. Today, I'm very excited to have on the show Dr. Jawad Ali. Jawad is a board-certified general surgeon practicing in Austin, Texas. Aside from his practice in acute care, trauma, endoscopy, and robotics, he has founded two initiatives. The one is a medtech consulting firm called Vality Partners. He helps early-stage companies with consulting, and also a nonprofit called Austin Medtech Connect to help a local medtech community in Central Texas. Jawad, welcome to the show. Thanks for taking time for me today. How are you?
Great. Thanks so much, Lucian. Pleasure to be here. How are you doing?
Yeah, I'm doing great. I'm very excited to learn more about general surgery because that's not really my experience and my background. So I have a couple of questions, and we'll start with that. The first part here on your practice, but just before this, I wanted to know, and the audience also know, what's your story into surgery? Why did you choose medical, and why did you choose general surgery?
Sure. Yeah. It's a little bit of a long story, a little bit of a short story. So I'm from Pakistan, and culturally, it's either you do engineering or you do medicine, and that's just kind of it. And so I did biomedical engineering in college, thinking it gives me both options. And along the road, I shadowed people in the ER and in the orthopedic space, and I really loved the practice environment of clinical medicine. And so I went to medical school from there, but I always wanted to integrate medical technology and some of the engineering aspects into my career. And
Okay.
so that's kind of why I went to medicine. And then along the road in medical school, I really loved trauma and actually critical care also because of the whole body approach. You get to do surgery. You get to look at basically every organ system in the body, but more on the kind of the surgical side. And then from there, I did minimally invasive advanced endoscopy because I liked the kind of the cutting edge operative techniques, cutting edge technology. And then that kind of brought me full circle into my current practice, which is kind of a broad mix of acute care, trauma, MIS, endoscopy, and then kind of doing all of the consulting and community building work as well.
Great. So you were really into medical technology from the beginning. So yeah, let's dive into what you call your practice. So I understand there are three parts: acute care and trauma. There are minimally invasive surgery and endoscopy. Acute care and trauma. What kind of pathologies? What kind of procedures do you treat routinely?
Yeah, great question. And it's kind of a nebulous term, right? Acute care surgery, but generally it entails everything from appendicitis, cholecystitis,
Okay.
to perforated bowel, diverticulitis, incarcerated hernia, severe and necrotizing infections. And then the other part of that is the trauma side, where we take care of injured patients. So anything from a fall with a hip fracture to a car accident to a gunshot wound. And so, the trauma team kind of collaboratively works to take care of these injured patients, and we're basically on call in the hospital, ready for them to arrive.
And how does it work? I guess this is a teamwork because when you have a hip fracture, you have an orthopedic surgeon and probably other specialties. How do you meet those guys very
Exactly.
regularly to discuss the patient? And
Exactly. That's a great question. And the patients, it's a little bit confusing even for the patients. Basically, the trauma team is the primary team on the patient. So let's say, for example, a hip fracture. So the trauma team kind of admits the patient, makes sure there's no life-threatening injuries like a pneumothorax or a heart attack or things like that. We stabilize them. We consult the orthopedic team. We kind of collaborate with them to make sure the patient is safe for surgery. And then once the surgery is done, we kind of help take care of the patient, and along with usually the internal medicine team as well for these elderly patients. So it's definitely a collaborative approach, both all the different members of the trauma team, but also it's very multidisciplinary. Not just including the medical specialties, but also like physical therapy, speech therapy, the nursing team, the dietitian, a lot of times the critical care team and things like that.
Wow, that must be a very rich experience to talk to all these people who do different things on this, for the same patient, and I think I guess you learn a lot from this daily, maybe tough, maybe difficult, but rich experience. So when it comes to minimally invasive surgery, what kind of what's your routine practice in this field?
For sure. So, during my fellowship, we did basically bariatrics, foregut surgery, anti-reflux surgery, some advanced endoscopy, including POEM, which is port oral endoscopic myotomy, endoscopic suturing with the Apollo Oversitch device, um, and then robotic surgery. And then currently, I do basically elective general surgery with MIS techniques. So things like robotic hernia repair, robotic anti-reflux surgery, and then also I do mostly diagnostic endoscopy with upper and lower endoscopy, and a little bit of the slightly more advanced techniques, maybe with like dilation and things like that, along with kind of just general surgery, everything from gallbladder to hernia to a little bit of colorectal surgery.
So that's a lot of different stuff. What's a typical surgery day? Do you have those different activities in the same day, or is it one day for acute care and trauma and one day for endoscopy? How do you manage this?
Right, exactly. Yes, I don't like to kind of schedule elective surgeries during my trauma call, just because, if I'm doing elective surgery and the trauma comes in, I like to have separate days. And so when I'm on trauma call, I'm on trauma call. And then outside of that, I schedule my, elective clinic, and then my either operative days or endoscopy days. Sometimes it's kind of 50-50. Sometimes it's, all OR or all clinic, but definitely separate kind of days. It almost helps in your mindset. You're coming in, okay, I'm going to be taking care of trauma patients, or you're
Mhm.
coming in, I'm going to be seeing elective patients. It's a little bit different.
Yeah, sure. Okay, so you talked about obviously robotics. I guess you are using the Da Vinci system, maybe the XI or X or S or SI, whichever model you're using. How does it work? Is it like for one or two or several specific procedures every time, every patient you use the robot, or you choose to use the robot depending on the patient, on the case?
That's a good question. So yeah, we have the XI, which I'm grateful for. I
Yeah,
definitely think
state of the
it
art.
adds a lot of
That's the state of the art.
state of the art. Yeah, I definitely think it adds a lot of efficiency over the SI, and is easier to use in some ways. But I do it selectively. I don't think the robot. I'm not like total practice, as I like to say. Robot for everything kind of surgeon. I think some patients benefit from the robot, some patients don't. And so I think it is helpful to have robotic experience when you're doing robotic cases, but it's also helpful to have non-robotic experience.
Mhm.
Whether it's laparoscopic or even open. You want to be facile in the different modalities.
So you are
And
trained both on straight stick and robotic approaches.
exactly,
Okay.
yeah. I mean, during my fellowship, it was mostly straight stick, and then I kind of worked to get more and more robotic experience after that. But grateful to have the straight stick experience as well.
Okay. So as a general surgeon using either a conventional laparoscopy method or robotics, what would you say are the top benefits of using a robot? Why using a robot?
Yeah, it's a good question. I mean, and we can get into this when we talk more about digital surgery also, but classically, as you know, I mean, I don't have to tell you about robotic surgery, but maybe to the audience, the benefits of robotics, a lot of it was mechanical, right? You
Mhm.
can control forearms, you have the wristed motion, you have the scaled motion, you have the tremor minimization, you have 3D vision, you can control the camera, it's very stable. Those I feel like now you can kind of see as like table stakes, right? This is like that's the bottom barrier to entry to a robotic platform. But to me now the bigger advantage of robotics is you can integrate what the surgeon does into the whole operative experience, right? So you can look at you can really analyze a surgeon's motions, because you know the robot has a capability more than just the laparoscopic instrument does. Beyond just with the camera view, the robot, you can actually integrate the sensors into it, and you can analyze when a surgeon did this, what was the patient outcome from that, and kind of connect those dots. To me, that's the most exciting part of robotic surgery. especially
So
moving forward.
yeah, so it's the data that comes from the My Intuitive app that basically analyzes the different phase and instrument movement and gives insights of this data, right?
Right. I mean, I think we're just at the beginning of that. I
Okay.
think I think it's that data, but then you combine it with the patient data, and you combine it with the post-operative outcomes, and that's when it gets really exciting. And we
Okay.
can talk more about that.
Yeah.
I think this we're just at the beginning of, to me, what is exciting about robotics.
So what I hear is because my next question was about what are the current limitations and what you see in the future for robotics, and I was expecting some maybe mechanical or software
Hmm.
features, but what I hear is more what you expect is more a connection between the
Hmm.
robotic device and the data that comes from the surgery or even before the surgery and after the surgery, kind of an ecosystem that ties all this data together and that provides some insight that is patient specific and that help you improve your practice, I guess, right?
Exactly. Exactly. I mean, I don't think the biggest improvements are going to come from, going from 8 millimeter to 5 millimeter to 3 millimeter. That's not the most exciting thing to me.
That's
you
the
know,
engineer view.
Yeah, that's engineer view, but to me, it's from the clinician perspective. It's, how do you really get the insights to improve meaningful outcomes?
Mhm.
Like let's say, for example, I do a inguinal hernia repair, okay, and the patient has like no pain afterwards, and I'm like, to me, I can like, it's hard for me to know exactly what I did better that time or
Okay.
what I did worse the other times, but the computer can analyze all that, and it can integrate that information with the information from thousands of other surgeons around the world. It can add that together to, to kind of create this collective experience that we can build upon, right? And before, that wasn't really possible. The older surgeons have their experience, and they have the experience of their teachers and mentors, but we can go even beyond that and kind of build a collective, knowledge base, and with insights that humans just aren't able to detect. And so that's the most exciting part. And the limitations, and again, we can go more into this, is really the like the data sharing. Some of the, the legal frameworks are catching up to this. We're not quite there yet.
So what I'm not hearing is the lack of haptics, tactile feedback. This is not something. I mean, you are used to doing surgery without this tactile feedback, and you get this kind of information from the endoscopic view or the visual images,
Right.
and that's okay for you, right? That's what I understand.
Yeah, that's okay for me. I think most robotic surgeons are not like, I really wish I had tactile feedback or haptics. That's not limiting us. And I'm
Okay.
not, and there's definitely robotic surgeons who are doing, way more advanced things, and I'm not hearing that from them either.
Okay, very insightful. So, just before we move to digital surgery, that seems to be a broad topic to cover. The I mean, the Da Vinci Intuitive Surgical has been dominating the market for more than 20 years with the Da Vinci, which is a great technology, obviously. And for the past couple of years, we've seen new companies entering the market, like CMR with the Versus system, Medtronic with the Hugo robot. There is a German robot, Avatera. There is a handful of companies coming from Asia, South Korea, Japan, China, a lot of system over there. There is also a French company that is developing a kind of a more collaborative system. What? How do you see this? What's your opinion on these different approaches to robotic surgery? Some are more bringing the surgeon to the table side. Some are more lowering the cost. What's your opinion? Are you looking to try this? Have you tried, and what do you think?
Yeah, I mean, so first of all, I mean, I think it's super exciting to have just options.
Yeah,
you know,
people have
I
been
think,
waiting for options.
yeah, yeah, I think that's great. I mean, no one's gonna say that options are gonna make things worse. I mean, I think options can only make things better, and it kind of pushes the bar forward. I mean, I think Intuitive has done an amazing job developing the technology, not just the hardware but the software. Also, of course, an amazing job with sales and support and building an ecosystem for the clinician, also ecosystem for the OR team.
Okay.
But I'm still super excited to have competition and outcomes and different things. I mean, talking to someone the other day about how the posture for the Da Vinci isn't great. To
Hmm.
do a long case in the Da Vinci, like, you know, it does put strain on your body, and so I'm excited about certain things like the open console.
Okay.
I think it's also cool to have cases where you can add a robotic arm if you need to. I think
Hmm.
you can do a laparoscopic case. If you need to do something advanced like some laparoscopic suturing, you can bring in a robotic arm to do that. I think that's a cool function. Um,
Yeah,
yeah,
that
I
that
mean,
that resonates with what you explain about your practice, being able to do either straight stick or robotic approach. So that fits your need. The previous episode was with another surgeon, pelvic surgeon. She was trained only on a robotic side for pelvic reconstruction. So maybe those kind of approach are not fit to her needs. So I understand there are various ways to do robotic surgeries with these kind of systems and those kind of new products that are CE marked and FDA cleared that will bring additional option for this kind. I mean, a variety of option for surgeon to do pretty much the same thing, but uh, maybe customized to their specific needs. Right now, there is one platform for almost everyone, so
yeah,
that's great. So moving on to digital surgery, I mean that's a broad topic. We it's kind of a buzzword, don't you think? Digital surgery. I
yeah,
mean, like AI. Everybody's talking about digital surgery or AI in radiology, the field I'm in, and sometimes you're like, wait, what's exactly are you talking about?
yeah.
What's your own definition as a surgeon of digital surgery? Is it like anything that has computer and data? I can put a stamp and say it's digital surgery, or how you see this digital surgery stuff?
Yeah, it's a great question, and kind of similar to what is medtech, like how do you define it, right? And I think there's no one term. I think there's kind of things that are like definitely digital surgery, like things like telesurgery or AR, and then things that are like kind of on the borders of it, like things like some of the data analysis stuff is that digital surgery, some of the peri-operative pre and post op is that digital surgery. I mean, to me, I operate with a broad definition and then having some segmentation within that. And
Okay.
we're actually working on a paper through Sages. Shout out to Dr. Nova Sozak, who's and then the rest of the team um, on defining digital surgery, because there is a need to say what is this, what is it all about, what's important about it, and have it from the clinician perspective rather and complementing the industry perspective. And so the way we broke it down was basically one part is robotic surgery, advanced instrumentation. One part is data collection. One part is data analysis. One part is telesurgery. And then the next part is advanced visualization, which is kind of the AR and some of the fluorescence
Okay.
technology, things like that. And then the next part is kind of the virtual reality and simulation. And so that's kind of the broad strokes of it. And I think all of that combined is digital surgery. And then in the data collection analysis part, I would add the pre and post op patient specific information, because I think that should be part of it.
Okay, and I'm thinking about I come from the neurosurgical space where that was a that surgeons were used to pre-plan their cases for years, for decades. So they have a pre-planning software. You load the CT or MR images, you identify the tumor or whatever anatomical part of of the brain you want to reach with a needle or with your instrument. And we've seen this coming into general surgery, I mean, laparoscopic surgery with the software brought by Intuitive and other companies. This kind of pre-planning software with the patient 3D modeling and visualizing the anatomy. That's part of where do you put this? In which category? Is it the data also?
For sure. I mean, that's one of those things which kind of crosses over, right? I mean, I think it crosses over from the data collection in terms of the pre-op imaging, data analysis in terms of, combining it with some other patient-specific factors, and then advanced visualization in terms of, giving the patient some intraoperative, guide, maybe in terms of like underlying organs or, vasculature, things like that. and then also in terms of simulation, because you can do simulated surgery on patient specific anatomy.
Hmm.
So it was things like that kind of cross between categories, but I definitely think that's part of it. In the GI surgery space, we're a little bit behind because it's more difficult to kind of plan around soft tissue, right?
Hmm.
It's not like
Yep.
bones or even like solid organ. Um, but definitely, things like neurosurgery, spine, brain, where you have the image registration and then guided
Yeah.
operations, things like what Mediview XR is doing.
Hmm.
I think that's huge, and I think that actually adds more capability and kind of next level functionality than some of what we think of as classical robotics, right? With some of like the wristed instruments and things like that. This is really adding something that you could never do before.
So your vision is basically the robot at the core, but adding technologies to the ecosystem to have a digital surgery platform. So let's start with you said telesurgery. For you, is it like remote operation, like you are in Texas and you're operating a patient in Alaska? I don't know, or
Hmm.
is it like telepresence system, like the Proximity or Avail or Explorer surgical system, where you can do a remote collaboration, remote case support, training with the cameras and stuff like that? What do you put under telesurgery?
Yeah, so I mean, I think defining it, you have telepresence where
Yeah.
you can kind of look into an OR and have basically kind of HIPAA compliant image sharing, and then you have things like telementoring with you can do things like telestration, right, where you can mark on the operating surgeon screen from far away. And I think what Proximity is doing is awesome. I love that company and their vision and their impact. Um, and then you have telesurgery where you can actually control the instruments from far away, right? And it can be like even when you're in the same room, it's really telesurgery because you're not
Hmm. Yep.
controlling the instruments. You're sitting at the platform. It can be in the same room, or it can be down the hall, or it can be across the world. It's just a matter of information transfer.
Yeah,
Um,
the thing is that telesurgery was started like in 2001 with the Lindbergh operation with a
yes,
cholecystectomy between Strasbourg, France, and New York.
yes,
But since then, I mean,
right.
nothing. I mean, other companies are moving forward in in the endovascular space. Siemens with a Corpus robot is steering catheter from, I don't know, 100 kilometers away. They've tried this. Robocat, and another company from France, is doing this also, the telestenting, where they actually want to operate from a distance to get to rural communities or
Hmm.
community hospitals. And I don't feel that there is this need to go to real telesurgery in the space of the Da Vinci system right now. Or do you feel?
I think so. I think there is definitely an impact for that because if you think about it, um, in these smaller hospitals, you don't have these super specialists, and you might not need them every day, but you might need them once in a while. So for example, there's a rural surgeon who's doing, let's say, even something like a gallbladder surgery, and they get into some complex biliary anatomy, and they don't, they've not really dealt with it before, maybe not be familiar, but if they can get someone to look over their shoulder and give them some guidance on, look, this is kind of an aberrant hepatic duct anatomy. I can tell you how to navigate around it. If you make an injury, I can help you fix it. Even so far as I can take over and fix it for you. That's so much more advantageous for the patient because now you're potentially avoiding injury, potentially avoiding conversion to open surgery, potentially avoiding the patient to have a drain and be transferred, things like that. So I do think there's an importance to that, at
Okay.
least in the U.S. And what's limiting us is two main things. One is obviously the technological infrastructure, right, where you can have this HIPAA compliant data transfer, and
Okay.
the other one is kind of the legal frameworks around it, where things like licensure and things like
Hmm.
that, and issues around liability come into play. But I do think it's valuable because um, it adds a level of capability to outlying places. Even like even larger centers may not have the experience of like the world's best experts, and so I'm excited about it. I think there's a role for that.
Cool, cool. And you mentioned Proximi. Have you tried this system, or have you seen it working in the OR?
I've seen it working just virtually, but I have not tried it myself. But what I like about it is it's a low barrier to entry. You don't have to buy like $1 million setup. It works in terms of it integrates both teams in terms of the image sharing, the telestration, kind of some of the other imaging about the patient in a HIPAA compliant, safe way. And they really have a mission to democratize, even though that word is overused, democratize access to advanced care. Right? I mean, Nadine talks about it all the time, where she really wants to give patients access to the best operative techniques and outcomes, regardless of where they are. So, I can really get behind that.
Cool. Yeah, that's very very interesting. So maybe that's you mentioned something about augmented reality, maybe virtual reality. I mean the in the robotic system you're using right now, it's already a 3D with you see the patient, so there is already some kind of augmented reality. How do you see virtual reality integrated into your practice? Do you use this kind of technology for surgical training? Like there are systems right now in the orthopedic space to, because the workflow and the instrumentation may be complex, so surgeon can train ahead of the procedure to make sure that they understand all the steps and take the right instrument at the right time. How does virtual reality could be applied to your space?
Right, so it's a good point, and it's a little bit different from specialty to specialty. I understand in orthopedics, you have a lot of instruments, a lot of
Yeah,
different screws, different patient anatomy, different implants. In general surgery, it's not so much the case. I mean, there's a little bit of virtual reality training in terms of like the Da Vinci modules, where you can train on, the steps of a gallbladder, steps of an inguinal hernia, things like that. But that is more at the very basic level, right? We're not there yet where virtual reality provides you a very accurate representation of the actual patient. It's just
okay.
not there. But things like what Innovus is doing with kind of the hybrid model, right? They have the physical model
Yeah,
to give you the fidelity of a real structure. Then they have the augmented reality overlay. Then they have the software analysis, right? I mean, to me, that's the best case scenario where you have easy to access physical model that you can ship out, and then you have all of the fancy stuff on the back end through software,
hmm,
because it's easy to scale that, and this Proxima is similar to that, where they have kind of the easy to access devices they send out, but then the genius of the platform is really on the back end, on the software side.
yeah. So it comes back
uh,
to the digital data platform. I understand,
right.
like the Innovus system yes, they have a surgical simulator with physical models. They have a virtual software, but they also have this data platform that enables to capture what happened during the virtual case, and then analyze what happened and what need to be improved, and give insight back to the surgeon. Yes, so I understand that. That's very insightful.
Exactly. And then
All
you
right.
can take that same technology and apply it to the actual case, and
Mhm.
kind of see, like the improvement in the actual case, some of the same analytics and things like that. So I think that's the most elegant solution type that I've seen is the low fidelity actual thing, or the easy to get actual thing with the really advanced software backend.
Okay. So just to finish with the buzzwords, AI, what, I
Yeah.
mean, for me, AI is more in the radiology space, to
Hmm.
automatically detect tumors or detect pathologies in chest x-rays, in CT scans, stuff like that. But a lot of people are talking about AI also in the surgical robotic space. Where do you see AI in there?
Yeah. Yeah. So to me, I think clinicians are kind of, even though it's a buzzword, I think clinicians are kind of sleeping on AI. I think it's going to be a huge impact in healthcare in the
Okay.
next 10 years. And I think, to me, I'm saying I appreciate your platform, because I'm trying to get the word out. Like, clinicians need to get involved with artificial intelligence however
Hmm.
they can. They need to kind of make sure that when companies are developing these technologies, that the clinician voice is heard, so that when these technologies get developed and implemented, they help the clinician be in a better place, not just help the system utilize the clinician more efficiently, or help with billing optimization, or even, obviously we want to improve the patient experience. But I also think it's a very powerful tool to improve the clinician experience, to allow clinicians to spend more time connecting with our patients, allow us to deliver better clinical outcomes, and not just kind of more superficial things. It's also important for us to help avoid some of the risks with AI, right? All
Mhm.
the some of the ethical things, some of
Yeah.
the things with health equity. I think clinicians are in a good place to really structure these technologies and guide them. And so I think it's definitely a buzzword, but I also think there's some real potential there, some real value there. But like every kind of powerful tool, you have to use it carefully.
Yeah.
And so, in the terms of robotics, I think the AI comes in. Obviously, the role of AI in general is to kind of parse through large data sets, right, and get kind of meaningful outcomes.
Mhm.
And so, I think similar here. I think in robotics, it's to kind of collect these. I think the basic building block of AI is the data set, right? And
Yeah.
I'm not an AI expert. I'm not a
Yeah. Now
coding
you're
person.
right.
Yeah, but from everything that I've read and learned is you have to start with a really good data set. And so to me, for surgeons, it starts with um, uh, a nice way to collect the data, whether it's the patient demographics, the operative video, the postoperative outcomes. Collect that information so that we can build algorithms that actually work and are effective. And so that's to me where it starts. And then we should be part of the conversation in terms of what capabilities do we want from AI, what's going to be most meaningful in terms of improving the patient outcome, and also in healthcare delivery. How can we make surgical delivery better? Because I think the biggest impact is on the delivery side, not on the tools side. I mean, the tool side is important, but if every patient got access to even the most like basic good care, that would lead to a higher improvement in overall care than having the select few get like the super advanced
Okay.
thing.
I see. Yeah. Yeah.
So I think AI can help with both, frankly.
Okay, I mean those are two very good points. So I understand you are a strong believer in AI as an enabling technology, as long as
Yeah,
there is the proper data set with data representative, no bias, and HIPAA compliant and stuff like that. And you expect surgeon to be more in this game at the very beginning to define what
I hope.
really
Yeah.
they want, what they need to improve
Yes.
the patient outcomes and improve access to care. That's I mean that's a great mission.
Yeah, and not just surgeons, clinicians in
Yeah.
general, and not just physicians even. Like pharmacists, nurses. I think clinicians in general have this patient-facing experience that no one else has.
Mhm. Yeah, I mean that's right. I'm thinking about surgery, but yeah, there are a lot of other people, other physicians, professionals that could benefit from AI with data sets. Okay, so that was that was a very insightful discussion about digital surgery. Now we'll move on to a bit more about yourself, the surgeon entrepreneur. So you have two initiatives that you took rather recently. You set up a consulting firm and also a nonprofit. Um, Maybe first question is, would you say you're an entrepreneur and why?
Yeah, I mean, I didn't classically think of myself as an entrepreneur because physicians in general, we're professionals. We
Mhm.
kind of do a job, get paid for it. We're not, in general, we're not business builders. Um, but I saw a need for medical startups to get good clinical advice. I feel like it was either you're a huge company, you get access to these huge consulting firms, or you're this small startup and you might have an uncle who's a doctor and you ask them. And so there was this gap in the middle that we were trying to address to help these early stage startups, get access to accurate and reliable clinical information that was also affordable. And so that was kind of the opportunity and the mission that I wanted to fulfill. And so myself and combined with two other physicians, Dr. Daniel Peterson, Dr. Tony Manuel, who I had actually both worked with in residency and kind of gave me my first exposure to real world industry and medtech work. I kind of combined forces with them and we formed this group. And we're actually in the process of kind of building it out further, bringing on more partners and growing. So excited to kind of show everyone what the next steps are for us.
So how was it created? Did you started to do a consulting job with a company, and then you thought, okay, I need to make something more structural about this and do a group, or it was an idea and you say, okay, I will start the group and then do the work afterwards?
So we were all doing medtech work, right?
Okay.
Dr. Peter Sanchi founded a company called Ep8 Biosciences, which has a FDA approved kind of hydrogel for tendon repair and adhesion prevention. Dr. Manuel does a lot of work in kind of perioperative care and some advanced surgical imaging technologies. We're all also basically full-time clinicians. And so, I thought that we're all doing this work kind of separately, and it would be really powerful for us to kind of combine our experience, our capabilities, and also kind of formalize the structure around it. But we were all doing this work, and
Okay, I understand now.
this just kind of put a like a box around it a little bit, and some publicity and some formality. But it didn't necessarily change the work we're doing that much yet. But the next 3 to 6 months, I am looking to kind of really add to our scope and add to our capability. So I'm excited about that.
All right. Is that common to have this model, group of physicians doing consulting, or is it something that you are creating in some way?
I have not found other groups like this, to be honest.
Okay.
And even when I go to conferences, like going to like LSI or the Surgical Disruptive Technology Summit or Today's
Mhm.
Next Big Thing, I mean, I haven't seen this. Surgeons are often kind of like lone wolves out there. And so, everyone's doing something, but this kind of collaborative team, small team approach, when you have these large groups, right, like M Disrupt or, these large groups that are kind of more like a database. But I haven't found this small team of, very experienced clinicians who are working together. I think it's a little bit rare.
So maybe can you share one example of one company or a topic that you help with doing some consulting or connecting with people so that the audience understand, yeah, at the end of the day what it is.
For sure. Yeah. So there's a company called Medtrack. They have a product called CareSense, which does digital patient engagement.
Okay.
Basically, they build care plans for patients. So let's say I'm having a knee replacement.
Mhm.
So, the patient would get a message on their phone telling them, welcome to Dr. X's practice. Here's what your process is going to be like. It guides them through some of the knowledge around the operation, guides even their caregiver into, how to help care for this patient, tells them what they need to do to optimize themselves for the surgery, prepares them for the operation, guides them to the postoperative recovery, rehab, pain control. And then they collect all the survey data around it through the patient experience. And so I helped basically Charlie Giamatti is basically a friend of mine now. We've been working together for several years, and I help them build some of these care plans, give them feedback on, integrating with some of the healthcare systems. And then, as needed, I can bring on Dr. Manuel for some of the anesthesia pain related things and Dr. Peterson for the neurosurgery related care plans. And so that's kind of where some of this partnership comes into play in terms of adding value for our clients. And so that's just one example, right? Through digital
Yep.
patient engagement, I've also worked with other companies. Like worked with Ambu in the past and helping developing some of their single-use endoscope technology, things like that. Some work with a company called Dynamic Light a little bit, talking about looking at um, advanced visualization without needing to inject any IV contrast to detect blood flow and things like that.
Okay. So coming back to what you said previously, you wanted to have surgeon early in the game. Are you focusing on early stage companies at the beginning of their product development, or is it more once the product is finished, doing some clinical validation or stuff like that? Is it more early stage or after the product is done?
Yeah, so I like the early stage part because you can have so much more impact.
Hmm. Yeah.
And it's a different role, right? I mean, once the product is done, it's in the market. You're not really looking to change it too much, right?
Yeah. Yeah.
It's kind of done. You're looking to maybe get some of the clinical trial work done, maybe some of the get the next milestones to meet their Series B fundraise, something like that. I usually work with someone that's between like a seed and a Series A,
Okay.
right? For example, where they have the team, they have a product like a prototype. They're looking to kind of fine tune the prototype, fine tune the market, kind of get their initial even like animal trial data. That's kind of the stage that I like to work at.
Okay, great. I mean, yeah, that's the kind of stage also I like. So, I mean, that's where you
Yeah,
have the most impact
yeah,
at the beginning, right? I mean, that's very very interesting. This group of people consulting for early stage medtech companies. Now, moving on to your non-profit, Austin Medtech Connect. What's the mission, and maybe why did you see the need to an additional structure? I guess there were already some groups to foster innovation and collaboration in the medtech community in Texas, where you live, where you practice. So, how did you came up with this idea to create a new structure, and why?
for sure. No, thanks so much, Lucian. So the mission of Medtech Connect is to break silos in the medtech ecosystem of Central Texas to catalyze our potential as a next generation medical technology superpower. And the whole thing started when, during COVID, I was networking with a ton of people, mostly on Zoom, and I realized how many people there were living right here in Austin. I would look up somebody on LinkedIn and, be like, oh, they're in Austin. Look up somebody else. Oh, they're in Austin. And,
Hmm.
everyone was very open to meeting. I was very grateful for that. And I met with so many different people. And I realized that they didn't know each other, or even if they did, there wasn't a place for them to go to work together. And especially as the city grew, so many people moved in, there wasn't this central community. And
Okay.
there were organizations that were doing an amazing job, like Texas Health Catalyst was working with kind of the Dell Medical School on the academic side. Texas Medical Device Alliance was working more on the industry side. Why Austin was working more on the broader life science, maybe bio side. But there wasn't this central community where, you know, people could interact in an organized way to help them get to their next step.
Hmm.
And, as you know, in medical technology, there's not just one or two stakeholders, there's like six.
Yeah.
You
Yeah.
have the clinicians, obviously that's my tribe. You have the engineers, you have the technical people, you have the investors, you have the acquiring companies, and then now additionally you have more of these large corporations like Amazon or
Hmm.
Apple or Meta, Google, and we're fortunate to have a lot of those second headquarters in Austin as well. So this provides a really interesting environment where it connects the traditional med tech community with this the high tech community, if you will, right? These like
Yep.
we have this amazing group of like uh, software engineers, and we also have a really vibrant startup ecosystem, and so I just needed a few more pieces, I felt like, to bring us like to catapult us
Hmm.
right into the game all of a sudden. When people talk medical technology, like they don't really talk about Austin, but I think that's going to change because we have so many of the building blocks. It needs some strategic connection, some structure that I saw this potential, and so that's why I started to build this organization.
That's great. I mean, it resonates very much with my own situation. We are based in south of France, Montpellier, and there are a growing number of medtech startups, especially in surgical robotics, and I feel there is a need also to connect people at various levels. You know, there are a lot of topics that we could share around quality, regulatory, clinical studies, funding. There are a lot of stuff that people can collaborate ways to help everybody grow and go faster to the market and for bringing a product to the end of the vision. And by the way, it's a kind of a small world because one of the podcasts I did was with Jay Pendleton, and he happened to live in, I think he lives in Austin, Texas, and
Yes.
I think he knows you. So I mean, even Central Texas is very close to Medtech south of France, and I mean that's great. It's a great mission to connect people to help everybody and raise the tide. So that's very interesting. And so you have this practice, right? It's acute care and trauma. It's endoscopy. It's robotics, minimally invasive surgery. You have this initiative, Vality Partners. You have this ecosystem in Central Texas. So there is a lot of things that you are doing in a 24-hour day. How do you manage your time? What kind of advice would you give to the listeners to say, okay, how is doing all that in a
Yeah.
day? You know? What's your tricks?
Well, first of all, to go back to your earlier point, I think it's awesome what you're doing. I see all the networking activity. I see your podcast. I see your community
Thanks.
building. I know you're CTO, co-founder of an early stage company. So, I love what you're doing as well, and I'd love to collaborate, Lucian, with you. I think Austin and South of France are both places people want to go. So, I think it could be super exciting. And also, congratulations on your work. Also, Jay is a good friend of mine. So, funny story, Jay was one of the first people I actually talked to about Austin Medtech Connect. He was super supportive.
Okay.
He was really instrumental in putting on our first event. He kind of actually got me into LinkedIn early
Mm-hmm.
on. And so, yeah, no, Jay is an awesome guy, and we're lucky to have him here. The second question, how do you fit it all into a 24-hour day? Some of it is just like Red Bull, so that's that's part of it. But
It's not time management.
that's not time management. I know it's performance enhancing drugs. But I would say the one is, I think it's two sides, right? One is don't waste time, and the other one is prioritize,
Okay.
right? And then you prioritize further, where you have free time to think about the next step, and then you kind of, it's like a cycle. It's like you don't waste time, you cut out things you don't need to do, because what's the expression? Nothing wastes time more than doing something efficiently that you don't need to do.
Mm-hmm.
Sometimes we get focused on like being busy, where it's really more should be focused on like doing the right thing. And so I'm learning that very much. So it's kind of like, you can take 50 meetings, but do you need to take 15 meetings? Like, really, you should take 10 meetings and then do some work and then think about the next step, that kind of a thing.
Okay.
And
So,
so that's kind of my baseline advice. I mean, also, we've got two little kids. My wife's a full-time physician. And so a lot of moving parts. But I think people like you realize that's what keeps it fun sometimes, is just
mhm.
having all these things going on and making progress. And also, frankly, for me, some of the most enjoyable thing is just getting to interact with people.
Yep.
I'm kind of a social person, like a extroverted introvert. I like these
Mhm.
small groups, and so to me that keeps it really rewarding.
So I guess this implies to say no more often than yes if you want to prioritize and manage your time,
Yeah,
right?
well, it's steps. I mean, I think early on I said yes to everything, and that was great. And then I started saying yes to less things, and then then you start saying yes to different things, and go from there.
Okay. Interesting. So I'll keep that in mind because I have lot of side projects.
Yeah.
All right, thanks. So maybe a couple of questions to end this episode, but to know a little bit more about yourself. So you explained to me, and I feel that you have a very rich background. So you were born in Pakistan, you were raised in Saudi Arabia, you lived in England, and you were trained in Texas. So that's just incredible. I was I was born in Paris. I did my studies in Paris, and I traveled, but basically, I work in France. So how this story shaped who you are today?
Yeah, thanks so much, Lucian. I mean, I think um, I mean, we're all shaped by our childhood in a lot of ways, and our background.
Yeah.
And so there's something to be said for having deep roots, a deep sense of community. And there's something to be said for kind of being a little bit of a nomad when you're growing up, and that was my experience. I was born in Pakistan. We left when we were 5, moved into Saudi Arabia, which, was interesting. You probably realize, but there's a lot of like international schools there where you have engineers from all over the world. And so
Okay.
I really went to school in a very international environment. I mean, I learned English young, like I was like probably 6. And then people in my class were from all over the world. And then, part of that is my dad got projects internationally. He actually didn't take as many. Some other friends went to like, Europe and Asia and, different places. And my dad just took a couple, but the longer one was in England, lived in London for a year. Actually was kind of a rough experience for me, I would say. But it was also any kind of adversity you get through, right, just becomes a part of you, and you realize that life is bigger sometimes than what's in front of you. And then we came to Texas, also a big culture shock, coming from the US to Texas, and actually went to LA, which was a big change too, going from Texas to LA.
Hmm.
And all of the cultural differences. Like as soon as you come to the States, you're trying to figure out Texas, and you move to LA, and it's like very different. And then since then, been mostly in Texas. been in California for a couple of years. But I think people that grow up in more than three places have a different view of the world in
Mm.
terms of they don't really visualize one place or one culture as this is what they know. It's kind of like there's all kinds of places, all kinds of people, and you kind of come to appreciate that.
Mhm. Yeah, I like this mindset. Yeah. All right. So maybe just a last question. So you're very busy. You drink a Red Bull when you need a little bit of more energy. But
They should sponsor us. They should sponsor us, Lucian.
what do you do outside of work to keep a balanced mind?
Yeah, so I hate to say that it's not so balanced right now. I mean, I think in the
Okay.
past I did jujitsu for a while.
Hmm.
I ran, I run and still run some now. But now it's kind of trying to squeeze in a little bit of activity every day. I mean, before this class, I did like a 15-minute Peloton workout, and so getting it where you can. But just things to do for fun. I'm a big Miata fan, Mazda MX-5 Miata. It's like the small roadster. In Texas, it's a little bit scary on the highway because everyone's got a big truck. But
Yeah.
actually, but actually go out to a rural community a couple times a month, and so there's some nice windy roads going out there, and so that makes it fun. The kids obviously is probably the biggest thing outside of my professional life is just kids and family,
Hmm.
which is always great. So those are kind of the big things currently. But I'm looking to, I don't know if you can see it, but I've got a guitar holder up there. I've had my guitar for a while, looking to pick that back up. So yeah, that's most of it. How about yourself?
Yeah, it's pretty much the same. I don't have much time. I have three kids. They are rather young in age. The first one now is now 7, and I have twins that are less than 2 years.
I see.
So it's been kind of a intense couple of
Yes.
years before, and that was. I mean, I got the twins right when we started quantum surgical, so it was quite
Oh,
an adventure. But
yes.
yeah, I'm more into nature outdoor activities like
Mm-hmm.
hiking. I used to do
Mm-hmm.
paragliding before I had
Wow.
kids, and I'd love to go back to that, but it really takes a lot of time because basically it depends on the weather, on the wind
Sure.
conditions. So you can spend the whole afternoon just waiting for the right slots
I
to
see.
take off. So right now I don't have all this time. So, but yeah, I look forward to going back to paragliding and
Wow.
mountaineering. Yeah, that's kind of and traveling, of course.
Yeah, that's awesome. I think there's something so powerful about just being out in nature
Hmm.
that you sometimes don't, you don't appreciate it until you do it. Living in the city, you get so used to your environment, but just being out in nature is kind of just good for the soul, for the mind. So that's awesome.
Yeah, it kind of breaks all the trouble and difficult thoughts that you may have coming from all the
Yeah.
stressful situations, and you come back to basic stuff.
Yeah. Also, just I guess with paragliding, I mean, I've never done it, but it seems like there's a feeling of just like letting go. Like
Yeah,
you're not that in control. You have to kind of
yeah, you
be
have to
okay
be
with
very
it.
patient, and yes, okay,
Yeah.
it's nature, and it's the wind, and you have to go with the wind, and
Yeah.
you do not control what's you just go
Right.
with
I've
it.
tried surfing, and it seems like not quite like that,
Yeah,
but in
yeah,
some
yeah,
ways,
yeah,
you
sure,
know.
sure, yeah, most probably. All right, we've done almost a 1 hour conversation. It's been great. I learned a lot about your practice, but also robotics. It's very interesting to see how you were both trained on laparoscopic and robotic approach, and all the thoughts that you have around digital surgery and all the possibilities that can be brought by technologies, and a lot of technologies around data, around virtual reality, around AI. So it's very exciting to see surgeons um, having this vision around what technologies could bring to their practice, and also seeing people like you driving a little bit more how the technologies will be shaped to really answer the unmet needs of the current surgical practice, and also helping others doing the same thing in a local ecosystem. So that was a very interesting. So maybe last question: how can people reach out to you and know more about Vality Partners and Austin Medtech Connect?
Sure. No. Thank you so much for the opportunity. I enjoyed this conversation, Lucian. I feel like the time went by super fast. So Vality Partners is valitypartners.com.
Okay.
Austin Medtech Connect is austinmedtech.org. And then the easiest way to find me is just on LinkedIn, Jawad Ali, MD. And yeah, I'm always happy to connect with anyone. Send me a message and I'll get back to you.
All right, hang on a minute. We'll chat offline. Thank you very much for having listening to this episode of the Less Invasive Podcast.